My name is Jennifer Webb McCrae. I am your Cumberland County prosecutor if you're from Cumberland County. I am working from home today, so this is a little bit different format for me. But we wanted to do another video on coping with COVID, staying healthy during stress and isolation. You might ask, why is the prosecutor's office participating in videos like this? Well, we have a policy prevention group called the Cumberland County Positive Youth Development Coalition. And what we do is we try to help children and parents make healthy choices so that they don't get involved with the juvenile justice system. So that's why the prosecutor's office is involved in this endeavor today. I'd like to introduce two people that I have with me. The first is Matt Rudd. He is a special agent at my office, and he works with me on strategic planning and programs that we do at the prosecutor's office. In addition to that, I have Dr. Kairys here. He is a physician, psychiatrist, and he's going to tell you—
Pediatrician.
Pediatrician, I apologize. And he's going to tell you a little bit about himself at this time.
Well, thank you, Jennifer. My name is Dr. Stephen Kairys. I'm a pediatrician. I'm at Jersey Shore University Medical Center in Neptune, New Jersey. I'm also a child abuse physician, and I've been the medical director for the American Academy of Pediatrics for about 15 years.
So we want to welcome you, and we have some questions for you on staying healthy during this social distancing period that we're all going through with COVID-19. As parents stay home with their children and they deal with their the fact that routines have changed, what should parents be talking about with their kids? How much should they share with their children about what's going on in the world today, and how should they do that?
Right. So I think they should be transparent. The children obviously know that something is different, something is wrong. A lot depends on the age of the child. For young kids under 3, I think all you can say is that you're just trying to keep safe. I think for kids 3 to 6, you can talk about that there is a virus. It doesn't hurt children, but you want to make sure that everybody else stays safe, particularly grandparents. And certainly for older kids, you can get much more specific about what's happening. So.
When kids ask parents, can I get sick with COVID-19? How should they handle that question?
Right. You should be honest. You should say, yes, it is possible, but you need to know that when kids get sick, it's like having a cold. It's a very mild virus. It doesn't really get you very sick at all. Kids don't go to the hospital for this virus. It's more of a problem for people that are older.
Okay. If a child gets hurt while, spending time in the house, not being able to be out and about, should parents be concerned about taking their children to the hospital right now?
Right. So they should call first. Every doctor now has the capacity to have either telephone, even televideo connections with their family. So always call your local doctor and just go over the symptoms that they can decide. I can say every hospital has very separate places for kids to go that's different than for the adults. And they're all equipped to make sure the kids stay safe and the parents stay safe. So if you have to go to the hospital, then that's something that you can do. But I would always talk to your regular doctor first.
I was just thinking, too, there's the, adding to the talking to your children component, that to tell your child that they might get a cold is one thing, but then also helping them recognize that they could spread it and they could make people that they care about sick, and that could be dangerous for them.
Right, exactly right. That's why it's really good to, when you talk about the virus, also talk about the importance of hand washing and keeping safe, and even teach kids how to hand wash, and maybe even make it a game, sing a song about washing your hands, because without a doubt, hand washing, particularly in kids, is the most effective way to try to prevent the spread.
So, doctor, in my household, now that I'm working from home frequently, my husband has CNN on most of the day. But really, when you turn to every news channel, every live television show, COVID-19 seems to be coming up. How much should we allow our kids to listen to or be up on the current events, as they happen minutely, in the coming weeks?
Right. I don't think it's good for adults to be on CNN all the time. To tell you the truth, it's really overload. All you're getting is repeats and repeats and repeats, and people kind of slamming each other. It's not particularly healthy. So actually, social media and TV, I think it's great to have some, but to really limit it. I mean, I think social media has always been an issue for kids getting too much social media. I think in this era, it's particularly an issue. So I would not isolate them, but I would keep it to a minimum. I think they should get most of their information from you as the parent, not from TV.
So I actually have a college-age son. He's in trade school. So when the epidemic broke out, he had to come home from school.
Right.
And my husband and I had to sit down with him and kind of have a really, it wasn't intense, but it was a serious conversation about you're not home to meet up with your friends. Mm-hmm. You're home to social isolate, because if you go out, you could get us infected or we could get other people infected.
Right.
How important is that with talking with our teens or our college age, kids who are home, and making sure that they follow the rules?
No, that's really important. Most teens see themselves as invincible and invulnerable, that nothing's ever going to affect them. So, yes, they need to know they're part of this story, that they may not get that sick themselves, but they can easily spread it to you guys. You're older. A lot of the people that are dying are, actually in their 30s and 40s. It's not just a disease of 80-year-olds. Actually, I just saw a recent graph that there's certainly more people dying over 85, but under 85 is not that different whether you're 40, 50, 60, or 70. So, no, you got to be careful. This is a dangerous virus. And I think you cannot take it too seriously enough.
What are ways that we could, prosecutor, I wondered how you have handled this, but redirecting our kids, especially the teenagers, right, who do want to, we've got reports of kids wanting to go play basketball. The weather's getting nice, so we're out and about, and it's tempting to make exceptions when the invisibility of the virus is present, right? So I didn't know if there's any strategies or redirecting kind of ways that we could get our kids to understand, but then also have an outlet.
Yeah, without a doubt, I think exercise is critical. I think for anybody, exercise is critical, but obviously you got to do it in a way that keeps you safe. So whether it's taking walks, taking a run with doing things with your family, most teens rarely do anything with their family. So here's an opportunity to actually do things more with their family in a constructive fashion. Take your boy outside and play basketball with him. That's fine. You guys are living inside together all the time. But don't have the neighbors over and do that. That just adds to the risk. So you have to be careful, but not crazy. So, but exercising is really important, whether you do it in the house, outside the house. Structure is really important. I mean, kids, particularly younger kids, everybody needs structure in their lives. And if the day is completely unstructured, random things happening, maybe they do a little homework for an hour, then they're off, just watching video games all day. That's not healthy. Kids particularly need structure, need to have things to plan for. If I see a lot of families now for the first time doing homework together and sharing things together. So there are some positives that come out of this crazy times.
It's been helpful for us. I have 3 young children. So we'll start with a little morning meeting and write, I actually have my soon to be 8-year-old writing down kind of what is the plan for the day. Right. And then she posts on the refrigerator, and it includes jumping on the trampoline and going for a walk.
Right.
That she's just learned to ride her bike without training wheels. So up and down the street, probably 117 times by now. So an outlet for her, but helping to plan those expectations and get a plan for the day is right for us.
No, you raise a great point. I've always been a big fan of family meetings to talk about things, and here's a chance that you're doing it every day. That's fantastic. Kind of starting your day with a huddle, talking about the day. You can actually end your day with a huddle too, just talking about what happened. And,
Yeah.
You know,
Let me create good expectations, because not every day we do it. We try, but not every day, because everybody's out of routine. So what might be good one day, suddenly becomes really hard.
Right. And unless you have obsessive compulsive disease, you're probably not going to do it every day. But try to get into a habit. Nobody. They try to have you not touch your face. It's very hard not to touch your face. So you just have to, do the best you can and just be aware of what's happening.
So Matthew, it's funny that I hear you saying that you're doing that. Sometimes when I realize I don't know when this is going to end, and it's kind of shaking my routine, which is working all the time and spending 12 hours out of the day out of my home. It sounds to me like what you've done by letting your kids create a list is you've empowered them to have, some decision-making process over how their day is going to look. And when there's other decisions that they don't have control over, you've given them some control over their life. And I can't think that that's not a positive thing for, young people and school-age children to be doing right now, to create some structure and to create some routine in their life. And you asked the question about, from the social justice, criminal justice world. I watch and I get all of the daily briefings from our governor and from our attorney general's office. We really have been trying to send out a message to the community that we are expecting compliance with our social distancing rules. It's a matter of life and death for our vulnerable populations. So in the coming weeks, if we can't get compliance by asking, you are going to see a ramp up of enforcement. And that's not a pleasant thing to do, but we all have a role to play in flattening this curve. So some of the things that I know that are going on in our communities is they've taken down basketball hoops because people were continuing to play basketball. And we know that's a close contact sport, which could spread the disease. They've actually, in Vineland, placed, hooks on the chains on the fences of some of the courts and, playgrounds, because we have to get to a point where we can stem the tide of this disease. So I don't say that to scare anyone. I just say that as a precautionary measure. We are, as Americans, we're used to having our freedoms, and we are asking people to dispense with some of our freedoms that we're used to help, the larger collective body, so we all can remain safe. And I think that's a good way. I know we've talked about that with our grandchildren. We do video with them every other day or so and tell them how much we love them. But it also gives us a chance to eyeball them, and for them to eyeball us. They're used to seeing us about every other week. And that gives them some comfort that, okay, life is going on, right? So what are some other ways? I know that kids will be on social media. They'll be on the internet. Do pediatricians speak to that, and how much of that is okay during this time? And what should we be doing as parents to make sure that, and grandparents, to make sure that our kids are safe from the medical perspective? And then I can talk a little bit about from the safety perspective as well.
I think social media is it's a double-edged sword. I think it's great for some connectedness and to share stuff with friends, but like anything else taken to excess, it's really detrimental. It can be very destructive. It can lead to a lot of negativity, a lot of social media, Facebook kind of stuff. It's can lead to bullying and all sorts of things. So it should be done within limits. I mean, I'm a big believer actually in keeping social media out of the bedroom. I think bedroom should be for sleeping and reading, and not for entertaining till 3 o'clock in the morning. That's not a healthy thing. Talking about getting into routines. So I think it just has to be limited. I think for everybody, I think it's Here's a chance to actually spend more time with your family, more time doing other things, and the family should try to really work together to make that happen.
Doctor, do you have any, either anecdotally in your practice or through your associations, other guidelines that are helpful? Like, we talk about limiting them, but sometimes that's not so tangible. And I understand context matters, but sometimes it's helpful for even kind of a direction for us to say, okay, a number of hours or a number of times or things like that.
Obviously, they're going to be on the computer doing their homework. Everything is online, so that's part of the game. But I think more than 2 hours, more than that a day is reasonable. I don't, and again, it should end about 10 o'clock at night or so. I don't think that's where you see it being abused the most. I think is these kids staying up all night playing video games or interacting with these chat groups.
So that's one thing I want our viewers to know. We are trying to put up some infographics, but also warn our parents that they have to be aware of what their children are, how they're connecting on social media and the internet. Now that kids are spending more time on the computer because they're home and more time, connecting through social media, the danger of, predators who prey on middle school age mostly or teenage kids by impersonating other kids to gain their trust, to get information about them, is more prevalent. So we want to make sure that parents understand that they have to be mindful of the things that their kids are doing on the internet and remain vigilant to make sure that they don't become victims of internet predators. We're going to post today in the comments, once this airs, some resources that parents can look to get information about that, to talk to their kids about the dangers of the internet. It's a wonderful place to get information. I've been virtual surfing museums all over the world, but it also can be a dangerous place, and we don't want to scare them, but we want to empower our young people with information so that they don't become victims as a result of the internet. So, Doctor, I noticed that, I go out once a week to try to get food to feed and sustain my 22-year-old who's eating me out of house and home. And when we go out, we have on our masks and we have on our gloves at this point. And I notice week by week, more and more people doing that. If we have to take our kids out when we go, how should we prepare them for seeing that in the store? And should they be wearing masks when they go out?
Right, those are great questions. I think there's going to be a time soon when we're going to be asking everybody to wear masks. I think the studies show that it does help reduce some of the spread of the virus, or at least it keeps you a little bit safer, even if it doesn't work the other way as well. So yeah, they're going to see a lot of people wearing masks, and I think it's hard. It's very hard to get a young child to wear a mask. So I don't think you should make it into a major fight. I would just try to rather keep them home than take them out and get into a fight with them about that stuff. It's just not worth the fight. But for older kids, yeah, they should be wearing masks. I think you're going to see very soon that there's going to be a lot of discussion about people regularly wearing masks, particularly when you're going to the grocery store or getting out in places where there's going to be a lot of people. I know a lot of the stores are trying to be much more vigilant. They're spacing out people that go into the stores. They're trying to keep the spread a little bit tighter, but it's still going to be an issue until the epidemic at least peaks. I think we're probably at least through April into May before we see any change in the way this is spreading across America.
So, in getting to a point where we wrap up, one of the things that I'm really worried about is that when we have families that have stressors in the best of times, be it financial, be it mental health, be it, not really knowing how to cope with conflict, it seems like there's a logical conclusion that would be heightened during a time where everyone's cooped up in the house. So from a criminal justice perspective, we're worried about additional acts of domestic violence and to a almost similar extent, child abuse. What can we tell parents and families about dealing with conflict and how to maybe, not deal with things as they escalate and maybe just kind of pull away until things calm down to keep everyone in the household safe?
Well, there's 2 or 3 parts to that. First, I agree with you completely that the stressors are going to be ever increasing the longer this goes on. People, particularly people that don't have great housing in the first place, people that don't have the social skills, that where there's already been some dysfunction in the way the family works. So it's really important for people to understand that kids are going to be under stress also. Kids get a lot of their anxiety from watching their parents. So when parents are in distress, kids are going to get in distress also. The more families can understand that kids are having troubles and going to have difficulties, they need to have more compassion for their kids, try to understand the situations that are arising, not use physical discipline, which is likely to get out of hand. Try to redirect. You can even use some time out if you want to try to catch them being good. Try to use a lot of positive parenting techniques. Try to use some humor. The more you can work together with your spouse or the person that's living in your home with you, so you're on the same page, so you're not kind of fighting each other about how to take care of the kids. You have to think about this ahead of time. You have to be more proactive. So much parenting is reactive. You wait till there's a mess and you try to clean it up. In these situations, you want to be proactive. Think ahead of time how you're going to respond to the day. I love Matt's idea about having a morning huddle, talking about today, talking about what's going to happen. Get kids involved in the discussions, have them be partners of all this. Sometimes take a time out yourself if things are getting out of hand. Just get away for even 10 seconds sometimes. Count to 10 can make a difference before you get involved. But I also really worry that obviously those kind of ideas don't work for families that are already in tremendous distress. And my biggest fear is that a lot of these families now there's no public eye watching what's happening with the kids. There's no school or daycare or other folks. So I'm hoping that everybody, grandparents, anybody else who has contact with those families that sees that the family's in distress, not to just put it off as just a time, but really reach out, try to get some help for those folks. Try to find what resources are available in your community to try to support and help those families.
So some of the things that we'll be posting as comments once this airs is that there is a child abuse hotline, and that number is 1-877 New Jersey Abuse. And there is an office of advocacy, which I have to imagine is a place where parents can call to get some help before the stressors get too hard to deal with. And that's 1-877-543-7864. That is run by the Department of Children and Families, Division of Child Protection and Permanency. In addition to that, we want everyone to know that, if there is domestic violence or the threat of domestic violence in a home, it's always important to have a safety plan and serve the provider of domestic violence services for Cumberland County is operational. So we will be posting in our comments information about how to get in contact with SERV in Cumberland County. That number is 1-800-225-0196. So we appreciate your time, Dr. Kairys. It's really gratifying to know that even in the midst of a pandemic, where I know you're probably working double the hours that you normally, the long hours that you normally work, that you're willing to spend some time with us, just helping the community understand things from a pediatric perspective. So we thank you for that. Matthew, do you have any questions or comments to wrap up?
Yeah, I'm so thankful, Doctor. Your ideas of staying vigilant of being creative, redirecting, while distance, stay socially connected. So great comments, super helpful. Thank you.
Good. Thank you all. Thank you very much.
Thank you. And we'll be doing more of these segments with professionals in our community that can help our community deal with COVID-19. And we thank you for tuning in with us today.